One.
Good morning. My name is Dr. Sheldon Fields, and I apologize for not being here in person to give you this talk, but I really am on vacation. And when they scheduled the talk, the vacation was already scheduled. So we're going to do this with the advent of some technology. But I'm really happy to be able to talk to you today about the Affordable Care Act policy practice and school health. And thank you for the Children's Trust for asking me to address you this morning. Before I begin, just want to tell you I have no disclosures, no conflicts. But a lot of what I say today is going to be based on my experience as a health policy analyst and a little bit of my opinion. So it must be reflective of that and not any of my current or former employees. They teach you to say that when you work in DC on the Hill. I established 5 learning objectives for the talk which you have in front of you. So we're here to talk about the Affordable Care Act. And we knew when the vote passed, 219 to 210, very close. It has always been contentious, but I will state up front that while I do not think this bill is perfect, I absolutely think it was a huge step in the right direction. The bill was actually signed into law March 23rd, 2010. So we are talking about the 3rd year of the bill now. I want to make some credits before I actually get into the meat of what I'm talking about. And that is, I want to acknowledge the late Senator Kennedy. And he worked on healthcare reform really over the course of his whole career. And Senator Mikulski, which was the senator that I worked for, took over his work on the Senate Health, Education, Labor, and Pensions Committee when he got sick and left the Senate. So tribute to Senator Kennedy. So what is the bill that actually passed? You know, you can read all 1,000 pages of the bill. I've read all 1,000 pages of the bill. But what actually was enacted was the Healthcare and Education Reconciliation Act, because the Obama administration, when a bill went back to the Senate, attached some educational reforms to the bill. And I've given you links to the bill. Look it up online, have a read. There are 9 titles to the bill. I'm going to focus my discussion on Titles 4 and Titles 5, which is dealing with the stuff that, contains the school-based health clinic information. So people thought that when the bill passed in 2010, everything was going to automatically change overnight, and we knew that was not going to happen. There are provisions of the bill that go out into 2022, but there have been some immediate benefits of the health care bill, and I'm going to highlight just a few of them. How about the fact that pre-existing conditions, especially for children under the age of 19, go away? Case in point, children born premature who once could have been prevented from getting health care insurance, no longer does that happen to them. We used to kick children off of their parents' health insurance when they went away to college, which didn't make any sense. So there's a provision in the bill that allows you to keep your children on your health insurance up to age 26. If the kid is smart, he'll ride that straight through graduate school. The elimination of lifetime and unreasonable limits on benefits. You could be in the middle of chemotherapy and they say, oh, you hit your limit, no more chemotherapy. That never made sense. That goes away. And we're starting to help seniors with the cost of their medicine and Medicare, i.e. that donut hole that many of them are falling into. Other things that have happened. I don't know if you've ever started to notice that restaurants at one point started posting calorie counts. And that was actually a requirement of the healthcare bill as well, that any restaurant chain that had multiple venues had to do that. And finally, I'm going to talk a little bit about the healthcare.gov website. That was actually mandated in the bill to be set up for the education of the American people. One of the other things that we did with healthcare reform is we did some stuff around our healthcare workforce. And I'm going to give you this background because you really need to get a sense of where we're at, where we're at with the bill today. So we were never good about forecasting what we needed in our healthcare workforce. So we set up something called the National Center for Healthcare Workforce Analysis. and the state healthcare workforce development grants. That lets each individual state plan for their healthcare workforce, because what we need in such a diverse state like Florida is very different than, say, a state like South or North Dakota, where you have more livestock than people and where the population is more homogeneous. So that allows us to do some better planning. I've given you a link for a quick and dirty explanation of the Affordable Care Act, and I'm giving you a Washington Post link, and I'm giving you some links to Kaiser Family Foundation, what we call YouTunes. Very, very humorous. I think you take a read and also pass them on to your colleagues and your clients. They're very well done. I've given you some website resources. These are the websites that I believe are the best vetted, unbiased. The first one being healthcare.gov. If you have never visited the healthcare.gov website, I really would encourage that you do so. It is the official website of healthcare reform, and it is kept up most to date. They also have it in Spanish. So one of the things that happened when the bill passed in 2010, and they knew that it was going to take a long time for things to get implemented. So things are stretched out. So we were going to have another election in the middle of this. So I want to talk a little bit about the impact of the 2012 election on the continued implementation of the Affordable Care Act. So not only did we re-elect our first black president, but we saw something that has been referred to as the rise of the Minority-Majority Coalition of America. If you look at the slide in front of you, each one of those groups that President Obama got the majority of votes for, in and of itself is a minority group. Group them all together and you have what is a minority-majority. Never again in American politics will anybody be able to win a national election such as the presidency by focusing on one socio-demographic, but especially not simply an all-Caucasian majority. That just will not happen again in American politics. Record number of women elected to Congress. We dealt with same-sex marriage issues, legalization of marijuana in the state of Colorado, and some interesting firsts, such as the first lesbian senator elected in the state of Wisconsin. What's my point? My point is, there were states that were sitting on a sideline waiting to see what happened with the election, so they didn't move forward with their planning. Florida was one of those states that really sat and didn't do anything in terms of planning because they were really hoping for a President Romney. And if that had happened, there would have been some dismantling of the health care bill. And my other point is our Congress still remains split. The House of Representatives is mainly Republican. The Senate is mainly Democratic. And as long as we have this split, the House is going to continue to take votes to repeal healthcare reform. They're mainly symbolic. So what is actually the current state of the healthcare law? It is law of the land. It has not been repealed. It is not illegal. So people shouldn't you should not be hearing those types of rumors that the healthcare law is not in effect. It very much is. But now we have states that are rushing to implement the various provisions of what is now the law, and always has been. It continues to be a major source of discussion and debate, but the Health and Human Services is really spearheading the implementation under Secretary Sebelius. So repeal is not going to happen. Even if both houses voted to repeal, it has to go to the president for his signature. He has the veto. He's not going to repeal his own law. Now, what has happened with things like sequestration is attempts at delaying the appropriation bills, i.e. stopping the flow of the money for the implementation, and we have seen attempts to do that. The other interesting thing that happened with the law was some legal challenges. And the legal challenges were mainly against the individual mandate, that the law that says that you can force somebody to buy health insurance, and the issue about the expansion of Medicaid. So what happened with the individual mandate? There was a case down in Pensacola, Florida. Yay, Florida. Judge Roger Vinson. And he concluded that Congress actually did exceed the bounds of its authority when it passed the act with the individual mandate, and that the individual mandate is unconstitutional and unseverable from the bill. Here's my point. If we could say that the individual mandate is actually unconstitutional, then the rest of the bill has to go. 26 other states also had some type of challenge to the Affordable Care Act. 2 other judges actually upheld the mandate. Florida also was the state that filed the constitutional challenge to the Affordable Care Act's expansion of Medicaid, joined by 25 other states. So what happened? The Supreme Court heard arguments in this case from March 26th to the 29th in 2012. There were actually 4 issues that the Supreme Court actually took up. I'm going to talk about 2 of the issues. The actual individual mandate, should we force people to buy health insurance? And the last one was, can we force the states to expand their Medicaid programs? What did the court decide? The decision came down on June 28, 2012, and they split their votes. The court actually did uphold the individual mandate, which basically means that it is constitutional for an individual mandate to require people to maintain a minimal level of health insurance coverage that is going to begin in 2014. The court, however, did find that the Medicaid expansion of the part of the Affordable Care Act was unconstitutional. They thought it was a little coercive in that we could not force the states to expand something that was going to cost them a significant amount of money. So the remedy for this was they made it optional, and states can actually opt out of expanding their Medicaid programs. Now, Florida, of course, opted not to expand its Medicaid program. I'm going to talk a little bit more about that. So the individual mandate is going to go into effect January 1, 2014 for all U.S. citizens and legal residents. It specifically excludes illegal residents. So if you don't buy health insurance, you're going to be penalized. $95 in the first year, up to 2.5% of your taxable income in 2016. After that, penalties will increase via cost of a living adjustment after 2016. So a lot of people are just going to wind up just paying the penalties because the penalty for the first couple of years is actually going to be a little cheaper than actually buying health insurance. However, they're going to miss out on the subsidies that really do come with the buying of health insurance as well. So there are some exemptions to the mandate. If you really can prove that you cannot pay for health insurance, there's a financial hardship exemption. There's a religious objection as well. American Indians, because they have the Indian Health Service. If you lose your job and you're not covered for like 3 months, they're not going to make you buy health insurance because it usually takes about 3 months for you to get another job. If you happen to be incarcerated, because ironically, if you actually go to jail, you get good health insurance. I wouldn't recommend going to jail to do that though. So the other thing is, if you live in a state where the lowest cost plan exceeds 8% of your income, you're also going to be exempted. There are some other provisions of the bill, like the hospital readmission. Hospitals are going to now start to get fined for discharging individuals who come back within a 90-day period. They're not going to get reimbursed for that visit. There are going to be some increased payments for practitioners in our Medicare program who act as primary health care providers. And then, of course, the whole accountable care organizations that are putting together plans that will save Medicare dollars. And if you can prove that you're saving Medicare dollars, Medicare is going to share those savings with you. The healthcare exchanges. So that individual mandate means that you can go up and buy health insurance in what is going to be called the healthcare exchange or the healthcare insurance market. If your employer doesn't offer you insurance, you can actually buy it on this market. What is an exchange? It is a transparent, competitive insurance marketplace where individuals and small businesses can actually buy affordable health insurance plans. There's going to be levels. Think about it as a bronze, silver, gold plan, and there's going to be various prices. The exchanges will offer choices that meet certain healthcare benefit cost standards. Even Congress is going to have to buy their health insurance through the exchanges. We estimate that 7 million people will gain healthcare through the exchanges in the first year, and up to 24 million will do so by 2016. The states had 3 options in setting up their healthcare exchanges. Set it up yourself, partner with the federal government, or have the federal government set up the exchange for you. And they gave the states a deadline, which was, of course, December of 2012, and they did actually extend it once. Florida, of course, didn't make a decision. Florida defaulted, and the federal government will be setting up the healthcare exchange in the state of Florida. So, like I said, it's going to be I have to meet certain essential, what they call the essential healthcare benefits, and it's 10 categories, and that's on the slide now. The National Association of Social Workers want it as a comprehensive benefit, comprehensive case management, and that actually was not listed as one of the services. So the healthcare exchanges, there are 26 states that are actually declining to run their own. Like I said, Florida is one of them. But we are going to have an open enrollment period for the healthcare exchanges from October 1st through March 31st. People are actually going to sign up. And they'll sign up via that healthcare.gov website that will take you to the exchange site in your state. You sign up, coverage will begin as of January 1. How much is healthcare reform going to actually cost us, and how are we going to pay for the healthcare exchanges and everything? And that's been a common question. Well, it's projected to cost about $938 billion over 10 years. But the budget office, the Congressional Budget Office, says they're going to save over that same 10 years $124 billion. So we're going to tax high income earners who will pay more for their Medicare coverage. Those who sign up for the higher cost plans are going to pay a little bit more, and those plans are going to be taxed. Sort of the Cadillac plans, if you will. We're going to be taxing Medicare device companies and drug companies as well. And it's going to be an excise tax placed on tanning salons. Not really an issue in a state like Florida, but in those states where people do tanning salons, there's actually going to be a tax that's going to go help support the cost of the Affordable Care Act. So what is actually in the bill for school-based health centers? Under Title IV, the Prevention of Chronic Disease and Improving Public Health title is subtitle B, called Increasing Access to Clinical Preventive Services. The Section 4101 is specifically addressing school-based health centers. And the Affordable Care Act established grants for school-based health centers, made upwards of $200 million available for school-based health centers that are going to provide comprehensive primary health care services during school hours to children and adolescents. Had to be on site during the academic day when school is in session, and they had to provide 24-hour coverage through some type of an on-call system. And they really had to be integrated into the school environment. The Affordable Care Act says that in the awarding of these grants, that preference can be given to communities that have good evidence that they've had barriers to primary health care and mental health and substance use for children and adolescents, communities that have a high per capita number of children and adolescents who are uninsured or underinsured and are enrolled in public health insurance programs, and then populations of children and adolescents that have historically demonstrated difficulty in accessing health and mental health substance use disorder prevention programs. Well, communities and schools all throughout Miami-Dade County clearly qualify for these grants. So what is happening in the School-Based Health Clinic Capital Program? The Health Resources and Services Administration, or HRSA, actually oversees this capital program. In fiscal year 12, $78 million was awarded to 197 grantees to put up 263 projects for new or expanded school-based health centers. In fiscal year 13, the upcoming year, there's been $75 million allocated that is going to go to fund another 150 school-based health clinic grants. The maximum grant is going to be about $500,000. I've provided the website here for you to go to find out more information about that site. The next slide I had here talks a little bit about the opposition of the Florida Medical Association. And I want to point out one thing. They actually oppose the expanded scope of practice of what they call non-physicians to practice medicine. Well, one, I don't think you start a conversation with anybody by calling them a non-anything, so therein lies a big problem. But the healthcare services that are done mainly in our school-based health clinics are really primarily done by nursing personnel, social workers, health assistants. The physicians are really not the ones that are primarily on site. So this historical opposition that the Florida Medical Association has is really going to be problematic, is their opposition to lots of other things that the Affordable Care Act is talking about. So what actually is going on in Florida in terms of the insurance and the Medicaid expansion part? Governor Rick Scott was historically opposed to healthcare reform until after the election when he made this statement. The election is over and President Obama won. Scott said, "I'm ready. I'm responsible for the families of Florida. If I can get to a yes, I want to get to a yes." That was Rick Scott backing off of his historic opposition to healthcare reform. Because Florida has the third highest number of uninsured people in the country, roughly about 4 million. Miami-Dade County has the largest rates of uninsurance within Florida also. And Medicaid eligibility in Florida is some of the most stringent of any state in the country. So Florida has what we call a Medicaid dilemma. And the Florida Senate voted 7-4 along party lines not to extend the Medicaid program as the Affordable Care Act actually describes. Florida actually wanted to put up its own sort of plan to fund health insurance through private entities in Florida. It's really not going to work the way in which they want. So, that being said, I really want to encourage you all to make sure that you're doing all that you can around advocacy with your professional organizations to foster the implementation of the Affordable Care Act. The National Association of School Nurses supports and promotes the Affordable Care Act. They talk about how every child deserves a school nurse, and the Student to School Nurse Ratio Improvement Act as well. The American Nurses Association also supports the implementation of the bill and the inclusion of nurses at all levels with expanded roles. The National Association of Social Workers supports it as well, and they advocate for the inclusion of comprehensive care coordination in case management as a part of an essential health benefit. And of course, the association also is always advocating for the Dorothy Height and Whitney Young Jr. Social Work Reinvestment Act. So you gotta be, as school health professionals, you have a responsibility to advocate for your profession, to help educate your colleagues in legislatures, to lobby for your scope of practice, to support those advocacy efforts by conscious raising PAC donations, maintaining your professional standards, and getting out in the media and letting people know what is in the bill for them, for the professions, and by joining your professional organizations as well. So what are my take-home points? The Affordable Care Act is the law of the land and will be implemented. Obamacare is here to stay. The passage of the Affordable Care Act was historic. It's going to touch the lives of every single American. You really have to know parts of the bill in order to educate and empower your patients. 2004 is going to be a benchmark year for the implementation. We're going to see the implementation of the healthcare exchanges and the individual mandate. The Affordable Care Act has many provisions specific for school-based health clinics that we really should be taking advantage of in this community. Medicaid expansion is available and will be key to providing healthcare coverage to millions of children and adolescents. Advocacy to support the Affordable Care Act is very necessary. Again, I really want to thank you for your time. I know this was quick, but I really wanted to make sure that we touched on some highlights and that you all had some time for the rest of your discussion. I will be forever grateful and indebted to the Robert Wood Johnson Foundation that funded my health policy fellowship that took me to Washington, D.C., where I actually did work on the bill under Senator Barbara Mikulski and was actually on the Hill the night the bill passed. I am always available to be contacted in the future, and I really would hope you do so if you have any questions. I'm also available to do other discussions and be more than happy to set up individual meetings, group discussions, whatever may help you all out there in the community. Again, thank you, and I hope you all have a really good rest of the day and a really good discussion that follows.